Hi, I'm Annalise and we'll be going over antibody testing for COVID-19. I'm going to be covering the three biggest questions, in my opinion, when talking about antibody testing. The first one being, what is an antibody, an antibody test, how and why do we test for antibodies, and what do the results mean? So first off, what are antibodies and antibody tests? Antibody or serology testing for the coronavirus is a test that is done after the individual has fully recovered from COVID-19, or it's done on somebody who is suspected to have had COVID-19 in the past. These antibodies are specific proteins that are made in response to an infection, and the test is used to detect them to see if they're there. These antibodies show the body's effort to fight the coronavirus, hence why they appear after you have already had the virus. How and why do we test for antibodies? Uh, Blood samples, typically by a prick of the finger, or they can also draw from your arm, are collected from the individual who has recovered from COVID-19 or who is suspected to have had it in the past. This blood sample is then tested to determine if the individual has developed these antibodies. So what do the results mean? If the results show that you have antibodies, it likely means you were infected with COVID-19 at some point. It could also mean you have some form of immunity against the virus. There is not enough evidence to mean that you're protected against reinfection of COVID-19, though, yet. That is a big possibility that they're thinking, but again, not enough evidence. Other important things to know: benefits to antibody testing include being able to donate plasma if you've recovered from COVID-19. This plasma could potentially be used to treat other individuals with severe disease, as well as boost the ability to fight the coronavirus.